with no base of.
Everybody, 10 o'clock, and I'm going to chair the meeting today. I think the boss lady is still in Alaska. I talked to her on the phone Sunday, I guess. So we call the meeting to order of our Health and Human Services Board. And the first item on the agenda will be approval of the agenda as presented. Do I have a motion for approval?
Did you want to change it?
And one comment on that, I'm going to change number 9 to right after public comments, or number 5. Mo is under, he's supposed to do a walkthrough at the government center. And so we'll accept that change, and then I'll call for a motion.
So moved.
Motion by Bill, seconded by
Ryan.
Brian. Got that, Madam Clerk?
Yes, I do think.
Any discussion? Hearing none, all in favor say aye.
Aye.
Motion carried. Approval of the minutes of our July 12th, 2022 meeting. That was all sent out. I looked it over. Good. Any other comments on that? Call for a motion.
So moved.
Motion and seconded. Any discussion on the July 12th meeting? Hearing none, all in favor say aye.
Aye.
Motion carried. Public comments. Madam Clerk, do you have anything?
None.
None? I don't think so. We usually don't. So we'll move right on to number 5. I don't see anything. Nobody has talked to me about anything. So we'll move on to that.
Vice Chair, were you at the meeting last time, or were you? They have you marked as absent.
I was on a call. I was on.
I just want to make sure you were
Yeah.
marked absent.
I was on the WCA down in Stevens Point.
Okay.
I'll make a comment on some of those things later on. So we're gonna move number 9 up, and so I'll call on boss manager.
Can I just make an amendment? I didn't see it before, but for me, there's a spelling error in the last minutes.
Oh, can you
Just
bring us up to date on that?
It's just the motion to adjourn. It says McCaffey, and I think it's supposed to be McKee. It's in minor thing, but
Oh,
we should have it. be correct.
well, we need to get those corrected. Thanks for your
Sure.
thanks for that comment, Rita. Got that, Madam Clerk?
It
Just
should
tell
be
me.
who? McKee.
McKee, thank you.
Oh, this is dangerous. McAfee and McKee.
I know, which one is, I thought it was you.
Thank you.
That's correct. Okay,
I'm
Dave.
sorry.
Everybody's got this mobile command center in front of you, otherwise there's some on the table.
Good morning.
Okay, proceed.
My name is Mo Norby. I'm the Public Works Highway Commissioner for Polk County. I'm here to talk to you about the command post. Vince asked me to look at the command post since we do a lot of fleet vehicles and large custom vehicles. Kind of a short presentation here. We'll start. Next slide. You don't know when an emergency is going to happen, but we can plan to be prepared. And that's what the command post is all about: emergency management and how we're going to handle these things. For a quick response, the various emergency and events that require emergency management assistance, crime scenes, missing persons, civil unrest. The issues with our current vehicle, why we're here, repairs. The generator is failing, the slide out seal and alignment is broke. So that tore a chunk out on when they had their night out. They opened it up and a piece fell out of that. The roof is leaking. The inverter no longer is functional. And it's just plain wore out right now. Uses for the emergency situations: law enforcement and public health. You can do outreach, events like the fair, Wings and Wheels, wherever EMS is needed to coordinate for safety. Could be a large fire. Next slide. The sheriff's department, Tanya and Don Burrows did a lot of work on this, working together to see what type of vehicle would be best suited for them. Our current vehicle serves as 911 backup. I'll get to that in a little bit. There's a little confusion on 911 and how that works. You can send the calls to another county like Barron County, but you can't dispatch our EMS from another county. So the call still has to come back here or dispatch to our place, to our units out here. It served as our COVID testing and vaccines, over 10,000 vaccines given. 85 mobile clinics provided in the summer of 2021, Menards, at Wayne's Food, Our Lady of the Lake Church. Past 12 weeks, been used for COVID testing in the government center parking lot. It keeps infectious people out of public spaces. Next slide. The county must have an option for emergency dispatch and paging. Other counties cannot do our calls. Like I said, they can't dispatch our people. They can receive the 911 call, but we still have to dispatch our people. We looked at the pros and cons of new versus used on the market right now. If you find used vehicles, they're from 9/11. Just like our unit, they're wore out, they're RVs, they're past their useful life. A single unit versus a tow behind becomes a place where when you have a tow behind unit, now you need another vehicle to tow it. Someone has to hook it up. It's very cumbersome if you have a larger trailer to hook it up by yourself and get moving with it. And again, you have to have another vehicle for that. Can be used for multiple departments. Well, it serves as an emergency response center and a temporary dispatch. The cost continues to rise on this. Don and Tanya have gone out for quotes on this vehicle several times, and since 2021, the first quote was $425,000. June 17th of this year, it's $725,990. You know, in this economy, things are just going up. Next slide, please. This is the unit that they came up with, based on a commercial chassis, LDV. This area would be the dispatch center. If ours went down in the conference area here, intake, people would come in the front door here, move through here. This is where your med clinic would be, and then the people can exit out the back. With that unit, there's unique things on it. These are custom built. It's kind of like a plow truck. You know, there's not every plow truck we have is custom built. With that, next slide. Unique items, an external communication board. So when you have an event or emergency action, you can portray things outside the vehicle to a larger group. Extendable mast arms, the camera for spotlights, search and rescue, two-door access, very important. Most of these can start, if you go on their website, you can see a base model of this, starts with one door, about 550,000 to 600,000 for the base unit, and you expand from there. So we'll be set up for dispatch if our current center goes down, very important. Next slide. Commercial versus used, the commercial frame versus the light duty frame, taking an RV and just converting that to one of these centers becomes problematic when you have a lot of people going through the unit at one time. The surfaces need to be more like stainless steel and wear. That unit would be all aluminum, no fiberglass. The frame life is well over 20 years, they expect on those. Long-term needs of the county, it can be updated in 10 to 15 years. What usually wears out on that is electronics you put in there. They become outdated, your screens, your computers. Safety, used for medical, you need durable finishes for that. That can be cleaned, washed, and those. And again, the existing units basically wore out. Next slide. That's really in a nutshell. Tanya and Don did a lot of work on this. You know, I went through and vetted and tried to see the used market. The used market is really not there for a commercial unit. If one comes available, you have to be able to quickly just encumber those funds and take it right away. You don't have time to look at it. In our purchasing policy for a used vehicle, you have to have a third-party inspection of that vehicle before you go. You have to visit the site and look at it with a mechanic before you purchase it, part of our policy. But that's really the update on the command center and where we sit right now with it.
Yes, I do. Okay, so you mentioned the 911 vehicles are the ones that are coming up on the market. Was this vehicle funded or granted, purchased? What was it?
For 911.
Yeah, was it
From the-
purchased, funded, granted?
Was granted from 9/11 funds.
So granted funds, we got our money out of what year is it?
9/11?
No, so it's a 20, is it
2001.
2001 vehicle?
You're asking about our current vehicle.
Yeah.
Yeah.
So it's a 2001 vehicle.
It's over 20 years
It's
old.
21 years old. It was funded.
I was on the board when this was funded. It was funded through 9/11 funds. And at the time I said, we probably may not have a terrorist attack in Polk County, but we're more likely to have a tornado,
Yeah.
which is true because then we had the siren tornado.
And
But
we
it was,
used
but it
it
was
there.
totally funded with 9/11 funds.
So we got our money worth.
Oh, definitely.
What? So is it? Shut up for a minute. Because I'm not really sure what the next step is. How do I get this thing moving?
I think,
Do we need a resolution or? Is that what we're looking for?
We have a draft.
we have a draft.
I think your next steps are either a resolution or you put it in equipment CIP and go through the budget process. It does need to be replaced. How that happens is either the resolution or through the CIP, through the budget process.
The resolution would require 2/3 vote, and I recommend it goes to the general government committee first. And then if you do it through the budget process, then that's something the board could vote on, and it's just a 50% vote, but included in the budget process.
So why not go directly to if it goes to this committee and goes to the board?
It would need to go to general government because it's spending county funds, so.
County funds or ARPA funds? Or are they
Same.
synonymous?
Synonymous.
Now they are.
But it would be amending the budget, so it would require general government and then
Okay.
county board.
Just another point that at the opportune time was at our Wisconsin counties seminar that I was at Stevens Point. I mentioned that we had this command vehicle and that it might be available on the our Wisconsin auction fund or something. And boy, some of these smaller counties, they were just excited that, that this might be something that they could afford. And so I think we're gonna get a much better price on an auction, Wisconsin County surplus auction than what we anticipated. And I think now is the right opportune time for that.
It is. I just worry about sitting on it any longer. I mean, with the prices and everything and.
Well, you can see we went up, what, over 300,000
Yeah, I know.
in a year.
In a year.
And that's not gonna be the end of
I know.
it.
So waiting for general government, I mean, that was what, yesterday?
Yeah.
So we gotta wait another month?
Well, the elephant in the room is that we have on the board meeting agenda next week is we have a resolution that's on the agenda to use all remaining ARPA funds to put into a government override. So we have all these, EDC has their senior housing program that they put together. HHS has this that they put together. We've got several different things that are being considered for this money, but yet next week we're voting basically up or down on where $2.8 million is possibly just going to get put away for different use.
That would almost kill this project.
Oh, and again, okay, so again, now it raises the temperature even further.
We,
Or my pulse, one or the other. I
we had
mean, I've been
this,
passionate about this for how long? We've been talking about this.
I've been very passionate about this.
Since I came on the board, so.
It would require a 2/3 vote for that one resolution that is on the county board agenda for it to pass. So it would take 10 of the 15.
We had this presentation at our highway meeting last Tuesday. And I think the highway committee was pretty enthusiastic.
So there's a good feel for it.
My call.
So it just sounds like no matter what happens, we're gonna need to wait for the wheels to turn.
Right.
It has to go to Gen Gov next month, then come to the county board after that.
Which is.
Are there any other questions for
September. Okay.
Mo's
So
presentation?
does this committee want me to take the draft and turn it into, like, put it on? make it
Okay, we'll
not just
move
a
on
draft.
from that then.
Yeah.
Great, thank you.
Hold on, hold on.
There is a draft of a resolution in front of you that I believe Supervisor Middleton put together,
That's correct.
and she's online. Yep. Amy, do you want to speak to that, please?
Yeah, so what you have in front of you is what, so we have actually been talking about this since I think last November. And what you have in front of you is I worked with Vince and kind of identified some things that we needed to flesh out. So we started putting numbers in there and timelines. I guess there's not a timeline. So that's when we sent Don and Tanya to the drawing board to really kind of flush this out, which I think is also a frustrating elephant in the room, which is we've been doing our due diligence on this committee and gathering information and letting staff have some time to pull together numbers and a framework for this. And then we have this pending resolution from Supervisor Olson, which would null and void everything. So I think maybe today what we should do is yet again reaffirm to the full board that this committee passes this resolution that's in front of you, so that we at least can say on Tuesday that the full board hears that this committee continues to really support this. And then logistically, I guess we have to go back to Gen Gov. I'm super frustrated, I have to say, how easy it was for the other resolution coming out of the blue, and all of a sudden it got on Gen Gov and it was on the board agenda before it even had gone through Gen Gov. And we've been all, plugging away, doing our job on this resolution. So I guess I don't know if there's any other way we can signal besides another vote today, how important we feel this is to the full board.
I agree that
Vote today.
if not only out of respect for all of the other efforts that are being put forward to do due diligence and to show the use case and the concept or proof concept of everything that's going on, that we should vote to, like you said, take the draft resolution
Out of draft.
and move that forward to bring it in line with everything else that's going on. And then regardless of what happens with the other resolution that we're talking about, well, Mr. Olson's resolution, and at least everything is in the same realm of consideration.
Agreed.
Bill, were you thinking about something under public comments? Next Tuesday, will you available for something?
No, I won't be available next Tuesday. I spoke to this command center last fall, to the board, to the county board. And I am also passionate about this, and this is something that they need. And I think this is one of those, it's not a stopgap, it's something that's going to be around for a long time. And I certainly am in favor of this resolution that Supervisor Middleton has put together. And I would have no problem at all moving this forward to the full county board. So I certainly would make a motion to accept this draft resolution, get this to Ms. Malone, and she can certainly tweak it and do the things that she needs to do to it, so it's on the agenda for the county board meeting next Tuesday.
Oh,
I'm in full agreement too, because I think I made the resolution last fall.
You did.
To purchase command center for $500,000 at that point.
That is correct. That is correct.
And
And
since
that's when the
then,
board should have proceeded, and we didn't.
Just to be clear, if you move it directly to the county board without going to general government, it will take not only a 2/3 vote to pass it, but a 2/3 vote just to bring it to the floor for discussion, because you would be acting outside of the rules of order, which you can do, you absolutely can do, but that would be the process for bringing it to the floor on Tuesday.
Malia, can I ask a question? If we fail on a 2/3 vote on Tuesday, can we then come back to Gen Gov and come
Yes.
back in again?
Yes.
So why should we do that, guys?
Amy, can we canvas? Can we figure out if we, either way, what do we have to lose, right?
lose, go back to general government.
Right.
If we go back to general government, it'll take the same amount of time as if we lose on next
Correct.
week.
But at least you'll know where
At least we'll
your
have a shot.
where the coins have fallen once people start voting.
That's right. I like it.
And I would probably call for a roll call.
Absolutely.
I would hope so. Put them on the line.
Absolutely.
Put them on paper, yeah.
Okay, so I heard a motion.
Yes, in a second.
In a second.
And we've had discussion, so
Any other? Yeah.
all in favor of Bill's motion, signify by saying aye.
Aye.
Unanimous. Got that, Madam Clerk?
Clarification on all of that?
Thanks, Amy.
that's
Cool. Thanks, Amy.
Yeah.
No? Are you gonna present this to the board?
I
Is this
can.
gonna get represented?
Is Amy?
I just have some
Gonna be
recommendations.
here?
Beef up a little
Amy,
bit.
will you be here for the board meeting next week?
I will be, yes.
She should probably
I think
be the
that's-
one to present this, and then
Are you good to present that then, what Mo just presented? Or, okay.
I sure can. Obviously Mo is probably better at it, I think.
Oh, yeah.
I think we want Mo to present that next Tuesday.
Yeah, I think Mo's presentation would be best.
Yes,
I
please.
agree.
We can do that next Tuesday.
Yes.
Okay.
Thank you.
Thank you, Mo.
I think it's a good
Okay,
idea
if
that
we
you-
got that all, everybody got a comment on this? Hearing none, we'll move on to number 6. Child support mid-year report, and that would be.
The other boss lady,
Oh, okay.
boss ladies.
Yeah. Well, nice to see them all here today.
So we have Malia
So
and
this is Nikki Ewing Vitalis. She has been with, well, she'll tell you a bit about her background, but she became our new child support director at the beginning of this year in February. She was interim at the end of last year. She has done an outstanding job, and I just want you all to know how lucky we are to have somebody this talented and this dedicated to child support as Nikki. And so I'm going to bust her bubble. She is very nervous about public speaking. And I'm very. I said you guys would be the kinder, gentler committee, so. if you could, like,
We are,
yourselves
we're
up.
all here with the touchy feely people.
Imagine us as all your best friends.
And
And you can turn around too and just speak to.
Just
the
give her
viewers.
a
And Malia, you are the child support boss.
I am the boss of the boss, right? Yeah, so I'm the corp counsel. She reports to me in our department and we share office space. And again, I'm just so grateful.
And Malia, thanks for all the work you do in the child support area.
So I originally came from the clerk's office down to child support, and I was a specialist since 2016. And like Malia said, became director in February. Our office is composed of 9 staff. It's clerk counsel. We have 4 specialists. We have an administrative fiscal specialist as well as myself. Child support operates through cooperative efforts of federal, state, local government to encourage parental responsibility and to offer social, economic, and medical benefits to families. Our services include paternity establishment, court order establishment, enforcement and collection of child support, as well as reviewing child support obligations. Over the last few years since I've been here, we've had a great deal of turnover. But currently, we're building a very strong and dedicated staff. 3 of our clerks are actually, or case specialists are actually from the clerk's office. I worked with them previously. So 4 of us are clerks. The other girl was a jailer in Washburn County. So everyone brings something special to the table, vast knowledge and experience in a variety of.
Malia, just one question. How many child support specialists do we have right now?
We have 4 actual specialists that carry a normal caseload, and then we have 1 person who is a fiscal specialist. I think she's 75% or 80% fiscal specialist and 20% backup support council stuff. And so we're finally fully staffed. We have, and I can tell you that we've got some folks that are coming in, and it's going to shake up some families because maybe the old specialist didn't enforce as much or held their hands through everything. And now we've got people who are fighting for the rights of the families. And so We might be getting some calls with why are you sending me this very interesting letter about perhaps going to jail if I don't pay my child support? And so I'm really I'm really positive about where we currently are. All of our staff is basically new. I mean, and it takes several years to get comfortable as a case specialist. And I think our longest is 1 year.
I've got seniority of years.
Right, you, but like actual, the
She's got
specialist,
1 year.
1 year. So, but they're all doing a fantastic job. And we get fathers' names on birth certificates. So in Wisconsin, when parents are married, the husband's name goes on the birth certificate, even if he's not the biological dad. And if you're not married, nobody's name goes on the birth certificate. If they're on any kind of benefits through economic support, we're going to get a referral. And for certain kinds of benefits, we are obligated to then seek a child support order, even if parents are together and not married. So let's say they're living in the same household. Let's say they go out and they get on Badger Care and food share, and they qualify for those things with both parents' incomes. We're still going to go forward and get a health insurance order. That's an order that says, hey, if either parent has health insurance available to them at a reasonable cost through an employer, they're obligated to get it. And that is something where we can, if we find out they're working for an employer who has health insurance, we get a court order, send it right to the employer. And so it bypasses the parent saying, I don't want to pay for health insurance. So we're trying to do things that not only saves taxpayer money, but make sure that a child is hopefully emotionally supported by both parents, but at a minimum financially supported by both.
I just want to take a brief minute so we can all understand the responsibility that these child support people have. They've got the toughest job in Polk County. When I was here before, we moved the meetings around a little bit like the Golden Age Manor. And I remember we had this meeting at Golden Age Manor, and I walked in there, and there was all these little birds and stuff that they had on the walls. And they tried to impress us that each one of them was a case. And I think we only had 3 specialists at the time. And so one of the gals or 2 of the gals on child support, they told us about their just an ordinary day. They just picked out an ordinary day. And they came to work at 8 o'clock in the morning, and they were called out to a home by the sheriff. And boy, how these people go to homes without sheriffs or deputies or something. To me, they take a lot of abuse. And anyway, all those cases was divided up into 3 people at the time. And at 4 o'clock, they had an appointment with the sheriff to go to a home. And the home was, there was 5 children there, and they were all infected with lice. And so these specialists fortunately, they had to go to an isolation, and between the old sheriff building and the government, there was an alleyway there and a room out there. So they isolated them there, and they had to go and get them all new clothes and everything. And they couldn't go back to the home. They had to find a place for them, which they did. And then at 7 o'clock that night, they were called to another home with the sheriff where there was child abuse, and they had to bring them in. And fortunately, they found a grandparent that would take these kids, so they had to be withdrawn from the home, and they had to get them meals and clothes and everything. And these 2 gals, they got home at 2:30 in the morning, and we're back at 8 o'clock. It's just a little bit of vision of what are some of our county people.
So what Supervisor Bonaprise is talking about is Child Protective Services, and that's in the other building. But we do work very closely with Child Protective Services, because when children are placed out of home and put into foster care, if there's a child support order, we're going to be redirecting that. We're going to, at some point, if out of home care lasts a long time, we're going to ask both parents
to contribute to the cost of that out-of-home care. And it's a fine line, right? Because you also want the parents to have the financial resources to meet the conditions for getting their kiddos back, especially if they're actively trying to, let's say, get sober or deal with mental health issues or deal with other problems within the home. And we want to make sure that we're not taking that away. So it is something where we work very closely with the child welfare social workers to make sure that we're making good decisions for those families.
And that also gives you another outlet on Malia's job, because outside of her normal, she's on top of all. Not too
So
many
what I was
county
gonna-
board people realize.
Yeah. So your case managers, they're working their cases, and then the fiscal side of it is what you're talking about, Lee, where they're checking into finances and
Right.
who's the daddy.
Who's the dad? We do genetic testing right in our office. So we'll test mom, dad, and baby, and you might want to know, why do we test mom? She was in the hospital, she was giving birth, we're pretty sure she's mom. Well, we've had women bring in other people's babies because they don't want the man to match the baby.
Oh
And
my
so
gosh.
I mean, that's not the only reason. It also makes it easier to tell because then you've got all the genetic
Right,
markers, but
Genius.
but we do test mom, dad, and baby.
Smart people.
Thanks for your contributions, and go ahead. Vital.
All right.
I think those discussions are good. It helps us understand our people.
Much of our funding is based on performance. The state of Wisconsin mandates an 80% performance level. While we're not at our 80%, we're getting closer and closer each month. At the end of July, our court order rate was 76.36. Our current order rate was 77.4. Our arrears rate is 69.95, but that's an accumulative rate, and the final will be the end of the year. We exceeded the state mandate rate for paternity. We're currently at 104.39%.
And that doesn't mean we have more than one dad on a birth certificate. It is really a bizarre way they do the mathematics to tell us what percentage, but we are over 100% at establishing paternity.
So far this year, Polk County has collected a little over 2.5 million in current child support as well as arrears. Considering the effects of the pandemic, current financial problems and unemployment rates, I think we're doing very well. Where we were 6 months ago, we were kind of lost and struggling to dig out, and each day we're making great progress.
We had a big bump when a lot of families were receiving that pandemic unemployment, because we do withhold from unemployment for child support payments. And people who hadn't been paying much at all because they were sporadically working, if they qualified for $5 worth of regular Wisconsin unemployment, they got the full 600. And so I think we were able to take up to 50% of it. And so that did help some families that had not received much child support prior to that.
Some big dates coming up for us. On the 11th, we have our triennial review with the state. The Western Region Borough Manager will be here.
And Bro is Bureau of
Regional Operations. She will be here to review our compliancy with IRS and civil rights rules and regulations, as well as our performance report. Good news, we are compliant in all of this stuff for the first time since 2019.
Congratulations.
Like I said, she's really been, she's here before most of the rest of the staff and stays past everyone else. Yeah, she's.
On the 16th, we have our IDC audit, which will review the accuracy of our state reporting.
What does IDC stand for?
Indirect cost.
Tammy said.
Indirect cost.
And then we're currently working on our budget.
So 66% of every dollar spent on child support is paid by federal dollars passed through from the state. And we get to claim indirect costs. So the cost of the lighting, the cost of, things that you wouldn't normally think about. If we can quantify it, we can capture that back and get that. So we're spending less actual levy dollars.
a father of children lives in Wisconsin and collects, benefits, Medicare or Medicaid and insurance and everything, unemployment, whatever. And he has children in other states. Is it up to the other states to get that child support, or does Wisconsin, is Wisconsin aware that he should be paying child?
That is a great question. So we have what's called the Interstate Compact on child support. And wherever the paying parent is, and you said father, but we have nearly just as many women ordered to pay child support on our caseload as we do men. And so wherever the paying parent lives, we will send it. No, that's okay. I mean, it used to be very different, but now, again, and we actually, I think, have a harder time sometimes collecting from women than we do from men. We have different calculations when it's based upon shared placement. So in a case where husband and wife get divorced, they both make incomes and they're sharing their children 50-50, we're going to take a look at both incomes and determine who should be paying. And so with interstate cases, we send our cases to the state where the paying parent or the non-custodial parent resides. And
Children
then,
that live here, you send to that state.
correct, and then that state establishes, unless there was already an order here, maybe they lived here at one point and then there was a divorce filing or a paternity action and something was ordered here. But if there's never been any case, we send it because only the state where that person resides usually has personal jurisdiction over that paying parent.
What? No children live here in this state.
It-
Only the father.
Then that state with the mother and the
They should
children,
ask
they would be
for them.
sending it to us to establish
For you, they are.
for them, and then our state sends them, that state, the money, then that goes to the custodial.
So on a clarification, Malia, if the father, because I know they used to move out of state and think they were clear. So if a father is charged with liability in this state and he moves out of state, that does follow with him. And
Absolutely.
we follow up on that.
And internationally, I mean, we have cases from
Yeah.
Canada, cases from Australia. We have treaties with many countries, and so we will find you. It is a crime not to support your child. If you have a certain amount of arrears and go 120 days, that's a felony. So if you haven't paid in a couple of years, that's multiple felony counts. And again, the goal isn't to punish somebody. The goal is to make sure that the
Well,
child
absolutely.
is supported. And when a paying parent loses their job, becomes disabled, is not able to work, we're going into court and we're adjusting those amounts down. We're saying, hey, judge, this parent can't keep paying what they were ordered to pay. So we're not always we are sometimes coming in and trying to help those non-custodial parents. Because again, if they were an intact family, the child wouldn't have the benefit of that income if they're not able to work.
Is there any penalty now, like so many cases? Well, the father will just, or not either parent will just maybe quit their job and to avoid child payments.
Yes.
I mean,
Absolutely.
Work for cash.
So that's called shirking, and the courts look upon that with disfavor. So if you were paying, let's say $1,000 a month in child support, and you said, I don't want to pay child support anymore, I'm going to quit this job and I'm going to go work for cash with my buddy down the road. The court's going to say, you have the ability to pay what you were ordered to pay before, you quit your job, you had no good reason to do so. And so if you don't pay your child support, eventually you're going to sit in jail.
Good point.
You use liens we put liens on all real property. There's something called lien docket. It's automatic once you hit a certain amount of arrears, right? And so if there is real property or vehicles, liens on vehicles, absolutely. We will suspend your driver's license. We don't need a court order to suspend your driver's license. We will take away your professional license. If you are a doctor, if you are a lawyer, if you carry some other professional license, it will go away if you don't pay your child support.
That is awesome.
You guys didn't mean.
That's great. I mean,
Well, it didn't used to be that way.
So do you have an investigative branch?
Unfortunately, we do not. And that is
That's
probably
the
one of the
problem.
biggest complaints is we'll get a parent calling our office saying, I know that the other parent is working. Look at their posts on Facebook. They're, redoing flooring and they're advertising for, do you want me to come redo your floor? And yet they come in with I'm, everything hurts and I can't work and so we don't, and we don't have anybody that's gonna go out and spy on them. But we encourage a parent who has evidence that a parent is shirking
As a judge.
to bring all of that evidence in. Absolutely.
And then the judge would.
Oh, yeah, we've had some fun ones.
That's
One day I'm gonna write a book, but I'll change all
No,
the
I-
names.
yeah. Unfortunately, I
I'm
know
gonna
a
say
few
from that,
stories.
from that 2 million that you've collected, on an average, how many of these cases go to court for a month? I mean,
But
are there a lot?
so we do have, I would say we probably have 25 to 30 court hearings per month. And sometimes that's just establishing the original child support order. Sometimes it's saying, hey, you're in contempt because you haven't paid. Other times it's modifying because somebody lost their job or is making more money. Or they had 5 kids, but the first 2 graduated and now we only have 3 left. So we need to
And
change
as a
those.
council, you have to present all them court cases.
I usually ask Mr. Loso to do that.
Yeah, well, you're on.
But I have been now back in child support and remembering how to do it. And I don't think I've messed anything up yet. Okay. Good.
So Malia, does this go before Judge Anderson or Judge Tolan, or is this over in family court?
All of the above.
All of you?
So only the judges can sentence non-custodial parents to jail for contempt. So when we get those cases, those end up in front of the judge, but most of our cases are scheduled in front of the commission.
Okay.
Awesome update.
Yeah, Mark?
Really was. Thank you.
That was great, thank you. For what you're
I
doing.
love this.
Hopefully all that work gets you to the
Next.
point where you're not, hopefully you get to be where you're not first in, last out.
Yeah.
And thank you so much, Ms. Malone and Ms. Vitalis. And we'll be moving on to number 7. And you boss lady.
That is me. Go on, okay? Okay.
No rest for you today.
All right, can you pull up it's not a very long PowerPoint, it's just to keep me on track, so I don't, start.
We'll keep you on track.
All right, so at the last meeting, we started at the end to have a discussion and it kind of morphed from, homelessness to mental health. And we started talking about that. So I said, let's put it on the agenda. So I'm going to talk about the 2 main areas of the law that our office deals with Tanya's department, as far as it goes with folks who are having a hard time caring for themselves and their adults. So you can go to the next slide. Chapter 51 is what governs involuntary civil commitments in the state of Wisconsin. And really, it is a situation where we're talking about taking away somebody's liberty because of their mental health. And it can be mental health, alcohol, developmental disability, or drug abuse. Those are the 4 things that can spark this type of process. And the court needs to make a finding that the person is one of those things, mentally ill, drug dependent, alcohol dependent, or developmentally disabled, and that they're dangerous to themselves. And when we talk about dangerousness, there's some very obvious ones. I'm feeling suicidal. My life has become unmanageable and I just want to be out. And that's an obvious dangerousness. There's another obvious dangerousness. Somebody who's out there saying, I'm going to kill you, or I'm going to beat you up, or maybe they do start and become violent. Very obviously dangerous. There's also some nuanced dangerousness. Somebody who is OCD to the point where they wash their hands so much that their hands are now raw and they're becoming infected. So they're dangerous, but they're not, if you didn't look at their hands, you wouldn't obviously know why they're dangerous. It could also be somebody who's so mentally ill that they're unable to seek out the services necessary to keep themselves safe. So they're so mentally ill, they don't know how to find a job, find housing, all of those kinds of things. So it's not your obvious dangerousness, they're more nuanced. So there's lots of different ways you could be dangerous to yourself or others. And then the third element is treatable. And this is key because, and we'll talk about this later, it differentiates the process of a mental commitment from the process of a guardianship. Dementia Alzheimer's, degenerative brain disorders are, although you can treat them to treat some symptoms, you're not going to treat them to cure, right? I mean, obviously. So we're talking about somebody who can be treated back to being no longer dangerous. Now, there are some people that are so mentally ill, and with all of the new treatments we have, their baseline is still going to be dangerous. We call that a chronic and persistent mental illness in the law. And so then we're going to take that out of the mental commitment side, and we're going to put that over in guardianships. And we'll talk about that in a minute. So we can go to the next slide. So this is kind of the process, like how a bill becomes a law, how somebody gets committed in the state of Wisconsin. So the first thing is law enforcement runs into somebody in the community. Maybe they call 911 and said, hey, I'm thinking of harming myself. I need some help, right? So that's one way. Another way, and it's not listed here, is 3 adults come into my office and they convince me that this person is mentally ill, dangerous, and treatable. And I draft a petition. Those 3 adults sign it, and we bring it before a judge to see if a judge will sign off. A third way is somebody takes themselves to a mental institution, says, I need to check myself in. I'm having a mental health crisis. They get in, and then they say, you know what, never mind, I want to be out of here. And the doctor says, this person can't go out in the community, they're dangerous. And so they initiate what's called a director's hold. So those are the 3 ways mental commitments start, but then everything else is the same. So those 3 ways to open the door, everything else is the same. Law enforcement picks the person up, whether it's that 3-party petition, those 3 adults and the court signed off, whether it's the director at the facility, law enforcement makes sure that the person is at the facility, and it can only be a locked inpatient facility. And so we have one of those in Polk County, and that's through Amory Behavioral Health. Law enforcement are often driving people to Winnebago, which is the state mental health hospital, because there are no other beds. There is a crisis, a shortage of mental health inpatient beds. But when we can find somebody in, when we can find somebody in and get them into Amory, we are ecstatic because law enforcement is happy because it's a short drive. The people are happy, they're in their community. And then when we need to bring them to court, it's just a hop, skip, and a jump. And so once they're taken, they're evaluated by usually a psychiatrist, sometimes a psychologist. And they give us a preliminary, do we need to go forward with court? Do we not? If we go to court, that court has to happen within 72 hours, excluding weekends and holidays. And that's just a quick, usually 15-minute to a half-hour hearing where we have the doctor testify. And the judge then says, yes, there's enough here to go to full trial. So this usually settles in some way. Either the person says, you're right, I need the help, and they agree, and we dismiss everything. The person agrees, signs a settlement agreement, making some promises to the court, or they stipulate to the full commitment. Commitments in Wisconsin are 6 months, and they can be renewed for a year, and a year, and a year, and a year. They theoretically could go on every year being renewed. The goal is not to do that. If you're renewing somebody every year, they're probably more in that need for a guardianship than a mental commitment because it's something that's going to be lifelong. So the goal of a mental commitment is to try to correct and get somebody back into the community with community supports. We do have jury trials on mental commitments. They are rare. They usually last about a day, sometimes 2 days. I average maybe 2 of those a year, jury trials. I think that's, do you have any questions on, that was a lot of information that I threw at you. We have, I would say, I think I just did this for our budget stuff. Last year in 2021, we had 83 mental commitment proceedings. The majority of the mental commitment proceedings that are initiated by law enforcement have something to do with somebody being suicidal. The majority of 3-party petitions, on the other hand, are alcohol related or methamphetamine related. And those are very sad because it is very hard to take somebody and treat them involuntarily when it's a substance abuse issue. And so the families are hoping for some type of come save my loved one. And we bring them, we take them, they're safe for a while they're inpatient. And then, so those are very heartbreaking and very hard to deal with. So now we'll move on to guardianships. And this is governed by chapter 54 and 55. So guardianships and protective placement. Some of these guardianship ideas are easy to think about. Somebody is turning 18. They are developmentally disabled and have some limitations, and their parents are going to need to make decisions for them going forward. And those are the easy ones. We go into court, everybody's in agreement, and it's very quick. The harder guardianships are somebody who has been competent their entire lives, and then because of a degenerative brain disorder or some other like incapacity, we now need an alternative decision maker. Most folks can try to avoid guardianships by executing a power of attorney for healthcare and finances. That doesn't always do the trick. The problem with the power of attorney is that let's say I name my daughter as my power of attorney. Jacob Malone is going to make decisions for me if I am ever unable to make decisions for myself. And then I get to the point where I don't remember that I did that, and I don't like the decision that she's making, and I say, I don't want to do that. Well, then you've revoked your power of attorney. As soon as you, in your now not competent mind, say that that person can't decide for you, it's gone. So you can do the advanced planning, but it still doesn't obviate the need for guardianship in a lot of cases. In our office, we will do any guardianship case for somebody who is indigent. And I let the social workers and the register and probate decide what that means. I'm not looking into their finances. I trust our adult protective services social workers to do their due diligence. Most of the time, these folks come to us because they have no other option. So our office handles those. We don't charge anything. And so in some counties, the court counsel does all the guardianships. That is not true for our county. One of the things that makes this different from chapter 51 mental commitments, somebody who is under a guardianship cannot go to an inpatient behavioral health unit unless they go through the mental health commitment process, or the guardian signs them in, they don't object, and we have a guardian ad litem appointed, which is an attorney, and the court says that they can stay. So even if somebody needs inpatient acute behavioral health treatment, if they're under a guardianship, it can be very difficult to get them into an inpatient behavioral health unit. The same thing is true for involuntary psychotropic medication. And there was a Supreme Court case called Helen H. that said that somebody who is under a guardianship, specifically for a degenerative brain disorder, cannot be protectively placed into an inpatient behavioral health unit, even though that's what they needed. So there's an issue in the law that needs to be fixed. They need to create some statutory mechanism by which somebody who is under a guardianship who needs inpatient behavioral health care can get that without having to go through all of these hoops, because we're actually harming those folks that need the help the most. And I understand the pendulum swung, because you don't want to institutionalize somebody just because they might have some behavioral issues. And we don't want a guardian to just be able to say, yeah, I'm sending you into this locked inpatient unit, and there I don't have to worry about you anymore. That makes sense. But there isn't a mechanism to get them when they need to get into those units.
Are you talking like people that need to come off of a psychotropic and change a med, or like, I don't know, there's doctors in here, I don't know.
So
what like a schizophrenic or
Yep,
somebody with bipolarism or something like
Yep,
that?
so if
Was also degenerate.
absolutely. So a lot of veterans that have PTSD and then end up having Alzheimer's later on, and those are the hardest ones because they've got some really significant behavioral issues, and they need some psychotropic intervention. And yet, because they're under a guardianship, it is incredibly difficult. When the VA can step in and help, that's extraordinarily helpful, but I can tell you that it is very difficult to get them qualified to go into one of the inpatient units through the VA. So I can tell you that Tanya's staff in our behavioral health unit are crisis folks. The work that they do on the backside where nobody can see, trying to find placements, trying to make sure our people are getting the care that they need. We're blessed to have the people that we do in Tanya's department, because their work, I think, is one of the hardest in our county in behavioral health. And they do an extraordinary job. We've got some great folks over there. rollovers from chapter 51. So oftentimes somebody goes in because they're in the community, it appears like they're suffering from a mental health crisis, they appear dangerous to themselves or others, so law enforcement brings them in, and then we learn, wow, this person needs a guardianship. So some things do start in chapter 51 and then move their way into chapter 54 and 55. Some guardianships can be very limited. Many people who are under guardianship retain the right to vote, right to serve on a jury. They just have some limitations where they need a guardian to help navigate things. And so those are the very limited guardianships. And then we have full guardianships. Obviously, if somebody is incapacitated completely, they need somebody to make every single decision. So it runs the gamut. Family versus corporate guardian. We always want a family member or friend to be the guardian in cases where that's appropriate. When that's not appropriate or they're not available, we seek out corporate guardians, and we have some that are located here in Polk County, others that we have to seek outside, but I think we're blessed to have the ones that we do, and we've got good relationships with them. And they are serving the folks the best they can, and I think that we are in a situation where we're hitting that critical mass, and there's not going to be enough corporate guardians to serve as we go on, just like there's not going to be enough foster homes and there's not going to be enough nursing homes. So it's something that is on the horizon, but right now we're okay.
Malia, do we have enough guardian ad litem serving in the county?
So guardian ad litem is an attorney appointed to represent the best interests. It happens when there are children in a divorce. It happens when somebody is subject to a guardianship protected placement. They have an automatic right to an attorney to represent their best interest. We have enough. The number is okay of GALs in Polk County. The number, we've got enough people.
God, I hate the way you're saying that,
I do
because I
too.
saw that
That's
movie,
underneath.
because I saw that movie about the Guardians. Anybody see that?
By Caroline.
Well, guardian ad litem, they have a huge impact on their.
And some of them are extraordinary and they're very good. We need more training for guardians ad litem.
That was my point.
Yeah, right. I don't think we have in this state.
In other states, a GAL is not an attorney. They're a person who might have a specialty in an area. They might be a retired social worker. They might be a retired teacher. But in Wisconsin, they have to be an attorney. And I can tell you, getting a law degree does a lot of things, but what it doesn't teach you is how to look out for people's best interests all the time.
That was my point.
So
So
that's well said.
Interesting.
In other states, it can be just a person who is able and capable, but
Right.
not.
Right. In Minnesota, they have professional guardians ad litem. They have staff guardians ad litem for certain courts. And then if that GAL has a viewpoint and they need advocacy, an attorney will be appointed to represent the GAL. Now, granted, you're adding one more person in those cases, but I do think then you get a different nuanced approach to being a GAL.
So how is this guardian ad litem funded?
Well, when we appoint GALs, our levy dollars through the court, through the judges, it's $100 an hour to a GAL.
So with the new bill that was signed, the gun control bill, there's a lot of money that is supposedly going to be available to probably more the guardianship side, no, the mental commitment side.
Both,
Anything coming down the pipes on that, or?
I haven't heard, but honestly, I haven't had a lot of free attention to take a look, but I will take a look. If somebody is mentally committed or put under guardianship, they automatically, through federal law, lose their right for life to possess a firearm. It becomes a felony for them to do so in the future. There are nuanced ways where a court can make a particular finding in certain circumstances where somebody could keep a firearm, but it's incredibly rare. So that is also a frustrating thing, not so much for guardianships, because generally those are considered for your life, but a mental commitment, if you now resolve you were incredibly depressed and felt suicidal and now have been treated, and now you want to go hunting and now you've lost your firearms privileges, it can be very frustrating, and we need to look at that law too. I think there's only one more slide. So protected placement, we talked about this briefly, but this is when maybe somebody is a wanderer or somebody is refusing to stay and has family that will help them leave a facility. Protective placement is a court order, and it can be into a locked facility, but it doesn't have to be. In fact, you can be protectively placed to your home if you have a caregiver there. And what that does is it allows law enforcement to get called and say, you know, Susie is out and she is, we think she's walking around downtown Amory. Okay, we'll go find her and bring her home. And because they know that there's this protective placement order. In Wisconsin, if you are under a guardianship and placed into a certain level of care, certain number of beds, every single nursing home, you have to have a protective placement. So somebody who has a guardianship over another person can't just put somebody in a nursing home. There has to be a court order saying this is the least restrictive setting consistent with their needs. Emergency protective placements, those happen occasionally. It often happens from emergency rooms. Somebody will go in because of a medical crisis and it's determined that they can't care for themselves in their home. Maybe there's nobody in their home that can provide care for them. And we can get them in quickly to a nursing home through an emergency protective placement. And again, that's Tanya's staff out in the field deciding when those happen. And that's our adult protective services unit. And we just had one gal retire. And she's been here much longer than I've been here, and she was extraordinary. But we've got some good staff and some good new folks that are out there and doing a fantastic job. We talked about the role of a guardian ad litem, role of adversary counsel. When somebody is looking at being protectively placed outside of their home, so into a nursing home or assisted living facility, they get an attorney appointed through the public defender's office because it's a loss of liberty. And so they might have an attorney representing their best interests advocating for nursing home, and then they might have their adversary counsel advocating for let them go home, because often that is really what folks want. And then we have jury trials. So I do about one of these a year. Most of my jury trials are termination of parental rights. The next is mental commitments, and then guardianships. Very rare, but I would say about once a year. And we already talked about the challenges between 55 and 51 when you have somebody who needs inpatient care but has a guardianship, so you can't get them in. So that's really all I have for the presentation today. Do you have any questions?
Just one question. If a guardian is assigned and then, you know, the person, the court order comes that they need memory care or something like that, and they're placed in there, the guardian signs them in to the home, and does that person then become responsible financially for their?
It depends. So if they are guardian of the estate, because there's two types of guardianships, guardianship of the person making healthcare decisions, vocational decisions, living arrangements, and then there's guardian of the estate. And so if they're not guardian of the estate, then it's still the ward and their assets that would be looked at. But most of the time, you're going to want a guardian of the estate or somebody with a financial power of attorney that can work with economic support to make sure that they're applying for benefits that they might be eligible for, determining what they need to pay for those folks. And I can tell you, we own a nursing home, Golden Age Manor. The county is the owner of that nursing home. And there are times when people get placed there and then the ball is dropped because maybe they have a financial power of attorney, but they're not following through with filling out the paperwork, and then a bill develops and gets larger. And so it does happen more often than you would.
They don't go after the guardian's estate, it's the
Right.
ward's monies that are
And yeah.
handed over
And
to the
if they
guardian to
have no
manage.
money, then do they go to the guardian?
So it would never be the guardian's financial responsibility from their own personal assets. However, if the guardian mismanages the ward's assets, there can be other issues. There can be removal, there can be criminal penalties, there can be other.
I see. It will get their money. Yeah.
Thank you.
Thanks, Malia.
Great
Just an
presentation.
awesome, just an enlightening to all of us of not only your responsibility, but everybody else. Okay, moving on, 8, fee schedule, who's in charge of
I
that?
can give the quick update on that.
You
I
have
know
some of
that
that too, Vince?
I can do that.
I think Tanya can do it, and I can tell you what was discussed in general government.
Yeah, that's my point was.
So we have, I don't know, 4 or 5 pages of different fees for all of the programs that we administer across the street. And we just did some small incremental increases to keep up with inflation. Just so if our counseling rate is $250, for example, I just want the committee to know that typically we don't get $250. It's whatever the insurance is paying us. So we set our rate. We are reflecting our actual costs with all of our indirect and everything else. But it's always dependent on what the insurance company is going to pay us for most of those clinical type of services. Otherwise, I know that they are looking at environmental health services. It's been several years since we've had an increase in the licensing fees. We're going to be working with the state guidance on what they're doing for their fee schedules, and come July of 2023, when the new budget year starts for that funding, we will look at those fees and if we need to increase or not.
Vince?
I would just say, you know, our new general government director, Don Wortham, gave a presentation in general government this week. He's got a fresh look at all these things, and he's actually going to kind of reform all these, not reform, give us a better overview of how we're doing as a county government in fees. As you know, our policy is to only charge what it costs us. We charge a fee, it's like a user fee. We calculate how much time goes into it, how much materials or whatever is going to be used, and we do what's fair, then it gets approved by general government and then the full board. In general, I can tell you that our fees are staying basically the same. There are a few that have gone up because of certain expenses that have gone up, but it's a very small percentage increase. I will say too, fees are a very, very small percentage of our budget. So if anybody says, oh, you're doing this to make money, I can tell you it's such a minuscule amount compared to everything else we spend, but it's a way to be fair. If someone is using county resources more than someone else for a particular thing, then sometimes it's appropriate to have a user fee. And it's not a moneymaker, it's rather a way to say, rather than charging all the taxpayers for this, it's a way to say you're using it, so it's your user fee that's included there.
So the answer to that would be it's a work in progress.
Well, we have the actual fees that have been proposed for the year. General government approved them as is, and then at the board meeting, all supervisors will be voting to approve the fee schedule.
So Don, in his new capacity, you and Don went over
Yes,
in that presentation.
yes, that will be at the meeting.
Well, thanks for the update on that.
Could we see that? We used to get a list of
Yeah.
that. Could we just have that sent to us, email or something?
Yes.
I'm, you know, and I know that it's minuscule, but
Yeah,
just a listing, so we can see what's being charged.
Yes, for the health
Yeah,
and
we
human
need to
services,
know.
I'll have Tanya send that.
Do you want the entire fee schedule or
Sure.
just community services?
Yeah, no, entire, I'm just curious to see what it looks like.
Okay.
You'll see the same thing too, Mr. Wortham said that as we were going through it, he goes, you can trust me, he goes, but you can also look, so it's good that you take a look at it. He said, you'll see there's very little things that have changed. He said even the ones that were increased are even below, you know, over the years have been below inflation. So
And you'll see 21, 22, and proposed 23.
Thank you.
Thanks for your update, both of you, on that.
Are we making a recommendation on that as a board?
General government does.
Okay.
we did that last night. So they approved it as is, and then it's gonna go to the board next week.
Thank you for including the whole fee schedule. Okay, moving on, legislative event report. I guess I'll bring you an update on that. Excuse me, I went to 5 events on 3 at Wisconsin Dells and 3 at Stevens Point and 2 in Wisconsin Dells. What that is, I'm the representative for the Wisconsin Counties Association. And the first one was July 8th And our sheriff's department had two resolutions, and I presented them. It affects everybody in a way. The first one was on recommendation to fund rural fire and EMS departments, a petition to the legislature to fund $30 per capita. If you look at especially the borderline in the state of Wisconsin, like from Bayfield all the way down, our rural fire departments, and yes, they just don't have the personnel and don't have the budget to operate. I think, Chairman Luke, way down into your Apple River, you can see where they're under stress. And so that did pass unanimously. Another one was to have the sheriffs and their deputies immune from lawsuits. And that is very important. All understand a lot of different types of lawsuits that affects, like, especially doctors and lawyers and all that. They have to have such enormous amount of insurance because of lawsuits and that. And that has really hurt our recruiting in our sheriffs and law enforcement. And I did get that passed. There was one gentleman from Winnebago County. I don't know how he was ever got on the county supervisor. I mean, the gentleman he had rings. He had
Careful now.
different things. He was very controversial, and he was very anti in that immunity. He was the only one that objected. So we did get those two passed. I don't think I had any from our HHS this time. I have several in the past, but I think altogether I presented 8 resolutions that established our county. And the important thing is this has never happened before. I mean, I've been around 20 years, and this is a great credit to our staff for having the vision to see where we needed. The only thing that you can bring up, by the way, in a resolution is something that fits every person or every county in the state of Wisconsin. Mayfield County had some that would affect, can we fund this or that? And those are automatically eliminated. It has to affect every county in the state of Wisconsin. And the ones I presented from our county staff did. That's just an update on what was happening.
Jenny,
Thank you.
what happens to the resolution after you present it?
It goes to the state. This is to have a resolution presented. This has already been screened by our staff, Wisconsin County Association staff. But then in August, and I think you already are going to be there in August at the state convention. Then the state convention, the resolutions are presented, and then they go to the legislature. And we have, Wisconsin County has 2, I would say, fabulous lobbyists at the legislature. Dan Barr is our one lobbyist, and the gal that worked for our Robbie, somebody was just promoted as another lobbyist. We're in very good, powerful hands here to carry those things forward. Otherwise, has anybody else got anything they want to present? I think we had a pretty good general discussion and informative from everybody. And Jay, thanks for being the chair and being at our committee. And so I guess we can.
Anything for next meeting though?
I always leave that up to our
think Dr. Logus is after a COVID report, maybe.
I am,
And
yeah.
looking
Oh,
at-
yeah.
So we have, numbers are going down across the states. Polk County is currently in the medium transmission or medium activity level range in the county, and that is number of positive cases factored by the number of hospitalizations. So we are seeing a few more hospitalizations, and it's bumping us up into that next area. Our percentage of positivity rate is 21.25% over the last 7 days. However, the numbers are lower in the state, but I think it's because we offer that free testing here at the county, and people come 5 days a week and get that test. We see a higher percentage of positivity through that alone. People are doing home tests, and we know that's a problem because that's not reported anywhere. We just hope that if they're seeing a positive, they're staying home and isolating themselves. But that's kind of out of our control. So I think that's where our higher numbers are coming from. We're glad people are coming in and getting tested so we can get them isolated and back in business within those 5 days. So that's where we're standing with COVID.
How does the state classify it though? They had us classified as critical for a
Well,
long time.
Yeah, so everybody was critical for a long, long time. And now they have this new rating system, low, medium, high. We're in the medium category now. We were low,
That's
but
better.
we just bumped up to medium. So just be aware and be careful.
What's our hospital rate?
So this is in Wisconsin. There were 51 hospitalizations with COVID-19.
In Wisconsin?
I think it's in Wisconsin. I have to clarify that.
What's not bad?
So it's down. I mean, we had
Do we have
hundreds
any
before.
hospitalized in Polk County?
That's why we're getting bumped up. I think we have a couple of
Oh,
known
okay.
hospitalizations. Yes.
Yeah, I knew there were a couple of things, right?
No deaths. I have not tracked.
Not that we know of.
There seems to be a whole lot of people now that
They
they just go and get a test, and this in-home testing is very
Nationally,
vital.
yeah, nationally, the death rate in July was 400 people a day. So in July, throughout the country, there were 12,500 deaths from COVID. So it's not over. And so I think it's just, the reason I was wearing a mask today was because I came through the door and said the COVID, it's our higher. So it's recommended you wear a mask. Yeah, no, I think that.
We applaud you for wearing a mask.
Yeah.
And then you were gonna say something about monkeypox.
Right. So you're hearing about monkeypox now. It is in Wisconsin. I think there's 25 cases, 26 cases in the state. The level of risk is low to the general public. I think they're seeing that it is more prevalent among the LGBTQ communities. So some awareness stuff going out on that. Locally, if we do have a case that will come through our webs, just like COVID cases do, we immediately work to do contact tracing like we did with COVID and get that person to a vaccination site so they can try to reduce any serious side effects from having the disease. And the earlier they can catch it, the less harsh it's going to be on you if you do have it. We just had a case where we had to connect a person to Pierce County. They have the vaccine they are administering, so we got them connected right down to Pierce County, and it worked out pretty slick.
That was good.
Tanya, or do you mind if I ask a question?
Go ahead.
So I know the Wisconsin you said, what about Minnesota?
I don't have Minnesota number, like the spread in Minnesota.
Yeah, I just want, I figure the Twin Cities area is probably more influential in,
Back County Metro.
yeah.
Possibly, I just don't have that number. I know it's in southern part of the state more of your metro areas.
Yeah, sure.
Yeah, but they don't give us locations, so it's just southern part of the state, which is more populated than we are up here.
That's a good point, Lilia. We should get more information like that because Polk and St. Croix County are part of the 9-county metropolitan commission. Anything else, we'll leave the, if you have any ideas for the, August agenda, September agenda, excuse me, be
We're
in
wishing
touch,
our lives away here.
be in touch with Tanya.
Well, we will have budget presentation. We should be able to do that. I don't know if we'll have our staffing plans at that time. We will do the 9:30 public hearing, so we'll have notice that we have to have that public hearing for our state monies that we receive. So we'll have a 9:30 start time next month. Yep. And legislative event report, program review. Were you interested in a certain program area for us to bring our subject matter experts in and talk? I don't have one listed, so.
That's
Choose one.
something that you can
Choose something that we would be interested in.
For what?
keep in touch with us.
Legislative, yeah.
Is there a regular, I'm sorry, go ahead, Dr.
If there's a legislative event thing that you want us to know about, please present it.
Okay.
I was gonna say, is there a regular rotation that we have through your departments on reporting other than midterm reports or any updates on legalities?
I'll have to take a look. Yeah, I think we have 43 different budgets that we run, which is about 43 different programs. We have
Yeah.
presentations we can give you to eternity.
Right.
If I was just asking if there's a particular area of interest, I know housing is coming up. So homelessness, unhoused. maybe
I would,
we can
that would
work
be
on.
great, actually.
Housing would be good.
Housing would be great, because I just was at West Cap yesterday and we've been.
Any updates on public transportation would be great.
The survey is out, but the public transit survey needs assessment, or public transit needs assessment, I guess that's what it's called. That is out, it closes August 26th, and we're sharing it out as widely as we can. We had really good participation at the fair last weekend, and I think the regional planning is pleased with our level of respondents so far, but it is open until the 26th, like I said. So there's a QR code you can scan, you can go online and complete it. We've got links on Facebook, on the website, we've got paper copies. People can call in and we'll complete it for them. So however we get that completed, and then I think it's by March, they'll be able to share the findings with us.
Vince, would you make a comment on our budget? We have for the full county board, we have a budget review, and by statute, the budget is passed on November 12th.
Is passed, but I would call most of the work by the board is done in October, at the
Correct.
October meeting. And that's where we'll present the budget that's getting rolled up now. We make our final cuts and adjustments and all that. I make the presentation to you all in October, after each committee has had their discussions in September. And then that's where the board steps in and makes amendments, proposals, or whatever, approves it, their general approval, and then the final approval comes in November, the second, I believe it's the second Tuesday instead of the third Tuesday, because statutorily.
I think, isn't it statutorily? Yeah, isn't it November 12th?
Yeah, is that like the second Tuesday?
Yes.
Yes. So that's when the November board meeting will be held.
Yes.
It'll be the same day as this. You guys will come in the morning and then 24 will be at night.
I think that's-
Okay, because there's the Tuesdays in November are the 8th and the 15th. First 8th and the 15th, so it would be,
Well,
It's statutorily, the county board has to have it on the second Tuesday in November, so it's the one
so it would be the
Tuesday.
8th.
Yep.
So that's the same day as our board meeting.
Right.
Oh, it's gonna be
Ours is always the second Tuesday.
right.
And the election.
And the election, oh, nothing going on that day.
Well, we'll still probably have
I
our
could go with
meeting.
Joe that day.
We'll still probably have our meeting.
I'll bring donuts.
It'll just be a busy day.
To that point, and this is completely okay, if not, I can still work around it. So Gen Gov moved to 8:30. That was partially at my request, just because of my work schedule. if in the future anybody would ever consider meeting at 8:30, I would be completely up for it, but if it doesn't work, we don't need to do it immediately. We can talk about it at the next meeting or anything like that, but give a little context to that. The people that I work with are primarily in California. So I'm 2 hours ahead of them, and when we meet at 10 o'clock, that's right when their day starts, and a lot of my communication with them is held off and just because they're starting their workday right when we start this meeting. But that's my problem. But if anybody would.
It's good to hear, an input from everybody.
Yeah.
Appreciate that.
Yeah, so if in the future, if anybody would prefer 8:30, I'd be all for it, but if not, like I said, I can make it work.
I think, I mean, it's about you, but it's not just about you, because if we want people on this board that, I'm still
Not
working.
retired.
I'm still working also. And so I think it's also just a question of how are we making this work on the board available to people who are still working? So I don't know, I'd be fine with an 8:30 meeting.
Well, that's something that would have to be
Maybe
put
we can
on.
put that on the
it'd have to be
agenda for
put
next
on the
time.
agenda. But appreciate you.
Can I,
So, call for,
wait, Tanya, I have one more agenda item.
Okay.
Can we also just keep the mobile unit on, just in case we need to take action on anything, or just follow up, depending on what happens in the next month with stuff?
Tanya, I'm sorry, I did not hear that.
Command post update.
Command post, thank you.
appreciate the input from everybody, and I'll entertain a motion to adjourn.
Yeah, go ahead. I'll second.
All in
McKee or
favor, say
Matt?
aye.
My daughters.
Motion carried.
Thanks for being here.